Hi, I'm Dr. Peter.
And I'm Hannah. I'm a dental technician, and we are from Dental Designs.
No, I forgot. Hi, I'm Dr. Peter.
And I'm Hannah. I'm a dental technician,
And we are from Dental Designs.
So, first off, I just want to say that it's really great to have an in-house lab because it enables us to communicate directly with our dentist. It bridges the gap between us and them, which makes things a lot more efficient because by doing so, we are able to communicate very quickly, and then which is why we can also do same-day crowns.
And I've got some patients that might think, hey, look, if you're doing a crown so quickly, are you compromising on certain aspects, like the quality? What do you think about that?
I don't think that we are necessarily compromising on quality. The only difference is that we are able to streamline things down into a much more efficient way. So for example, we integrate the use of technology into our lab so that we are able to do things a lot quicker. For example, in fact, when dentists used to do crowns in the past, they will have to take an impression, and then once they send it to a lab, we'll have to cast it. So that process takes maybe 1 to 2 hours for the stone to set. So by doing so, you're already cutting out maybe a couple of hours in a day. And then in the digital lab, what we do is that once the dentist actually scan a digital scan, they send it directly to our lab, and then we use a software to design it. So that part of casting the model and also waiting a long time is already being cut off the day. So for example, when it comes to milling the crowns, it provides us with a very good framework to work with right off the bat. So the rest of the things that the dental technicians have to do is just to do the fine tuning to make sure that the crown is of a good quality.
And then would you say what about the material? Is the material we use at the clinic the same that you would find in like a regular lab outside?
In fact, over here, because we are in Singapore as well, a lot of the materials that we use has already gone through a vigorous testing and also a lot of approvals. So I would say that the dental materials that we use here are all very good, high quality materials. And then also because of that, in fact, a lot of the crown materials that we use comprise of the same composition. So there's really no difference in terms of the materials that we use here.
And I really love having the lab right here because it makes it so much easier. When I've got a complex case, I can just walk right over, talk to the lab technicians, and then figure out exactly what I want for the patient. And then we can collaborate and get to the best results.
Yes. Yeah. So for example, when we have to take shade photos, for example, we are able to directly pop into your room and then have a direct interaction with the patient. Whatever that we see in real life, we are able to also take them in higher quality photos. For example, we have our own in-lab camera, which has already been preset to our preferred settings, so that we can capture the depth of the color, the most accurate reference that we can have. When we bring it to the lab, we can actually try to mimic it as close to the real tooth as possible. Yeah.
And because most dental clinics, they'll actually usually send their work to external clinics, and that process usually will take a couple weeks. It's a lot slower, and so having the lab here makes it so much faster for like adjustments, like adjusting your shades and things like that. And so that makes it so much more faster and much more beneficial for the patient and for us.
Yes, I think that is absolutely true. I think that sometimes you might not get it right off the bat, and it's a lot more convenient for us to make the adjustments, especially when you need some help with the shade, or if there's some proximal contacts that are a bit tighter, we can always bring it back to us. So it makes the dentist's life a lot easier, and then it also allows us to understand the dentist's preferences as well.
It's definitely a win-win, faster for the patient and better quality control for us. And I think it shows how much care we put into each and every case, because every case is so different.
Yeah, And I think for same-day crowns, it really takes a lot of teamwork, collaboration, as well as the interaction with both our dentist as well as the patient to create something that at the end of the day, everyone is satisfied with.
Yeah, definitely. So thank you, Hannah, for clarifying all these questions that patients might have and helping them to kind of understand the process that goes behind the scenes when we're doing one of these cases for them.
Yeah, my pleasure.
Cool.
Cool, my pleasure.